Well, welcome to ICMDA webinars today. I'm Dr. Peter Saunders, CEO of the International Christian Medical and Dental Association, which runs this series. And this is our 7th in the series of COVID webinars. Today's title, Life Beyond COVID-19. I wonder if you imagine there is life beyond it. So let me introduce Patrick. Patrick, it's wonderful to have you here. You're a very busy man, and we're delighted you could join us. Patrick is the chairman of Global Change Limited. He's the author of 16 books on global trends, including The Future of Almost Everything. And he's been ranked as one of the 20 most influential business thinkers alive today. He's spoken to audiences in over 60 nations and is one of the world's most sought after keynote speakers at corporate events. He's often described as Europe's leading futurist with a long track record of success in industry forecasting and has worked with over 400 of the world's 2,000 largest corporations in every sector, every industry, and every region of the world. His clients include groups like Google, Microsoft, IBM, Bank of America, a list too long to mention today. But most importantly, Patrick is also a doctor and a Christian believer, and he has in-depth professional insight into new viruses and impact of pandemics like coronavirus, COVID-19, through his work in preventing the spread of HIV/AIDS, which began way back 32 years ago when he set up ASET, AIDS Care Education and Training. So Patrick, we're delighted to have you join us today. Over to you.
Thank you. It's a real joy to be with you today, and welcome to you wherever you are in the world, from Canada to Senegal to Russia. We're translating into several languages, and it's so exciting that in the middle of all this crisis globally that we can gather virtually. And Jesus said, when 2 or 3 gather together in his name, he is there in the midst. And in a strange virtual way, he is more present with us because we are gathered together than we would be if we were just doing our own thing. So my hope and prayer is that as we go on a journey together into what is happening medically with this pandemic and what the Lord might be saying to us, that I pray that you are encouraged, whatever situation that you find yourself in today, hopefully. Okay, so life beyond coronavirus. And you know, but not everyone in the world knows, that you can't kill a virus. All you can do is damage it, because the virus, of course, isn't alive. It's just the ultimate nanotech robot, this little strip of genetic code, the cream-colored coil there, the lipid layer on the outside in red, and then, of course, the handles of the virus, which give it its specificity to latch on to particular cells in particular species. And I guess that, as the ultimate nanotech robot, it's hard for us to see how you can find strategies to defeat it. But we will look at that. We will look at life beyond COVID-19 and a wider context. But first of all, what we need to understand is that there are around 4.3 million people who we've detected with the virus, but that's only a tiny fraction of the actual situation. And we think that 291,000 have definitely died from it. But in the UK, I would take every figure and multiply it by 2 at least. In Italy, the same, and probably the same in your country, or maybe even more. And of course, the challenge with this virus is that it attacks those we love the most. It spreads along the lines of relationship. It spreads along the lines of teams, the people we work with the most. The shocking thing about this particular virus is the doubling time. With HIV and AIDS, we thought that a doubling time of a year was pretty bad. That is the time it takes for 1,000 cases to become 2,000. But in the case of this particular virus, in London, we've had a doubling time of only 2 to 3 days, 2 days in some parts of London. And although it doesn't sound too bad, you go from 2 to 4 to 8 to 16 cases. Actually, a doubling time of 4 to 4.5 days is pretty critical, because and that's what's been the case in most parts of the world actually before lockdown. And if you have only 4 to 5 days between one doubling and another, then in 20 doublings or 3 months, you go from 1 case to 1 million. if you have 1,000 cases in a country, you go to 1 billion cases. Now, of course, you run out of people long before then in one country. But I'm just saying that is why this virus has been so extraordinarily worrying. And when you look at the spread and compare it between different countries, you see huge changes. So this is 12th of May. If you lay on the same line, 3 graphs, each of them start at the same point, where you have just 150 cases. And then you map what happened. And you can see a huge difference between Italy, which had overwhelmed its own hospitals with COVID-19 in parts of that country. But it's now relatively under control, whereas in the US, you're seeing them experiencing explosive spread. South Africa looks fine on the chart, but the challenges in many African nations is detection and whether the right systems are available to really be sure about what's happening. Now, the wider context is this. As Peter mentioned, I first became involved with mutant viruses 32 years ago with HIV, which is just another virus which jumped from animals into humans. But HIV has already killed 45 million people, to put coronavirus into context. And we have another 45 million who are living with the virus. And we've seen new viruses emerge somewhere in the world, roughly every 12 months. And you don't necessarily hear too much about them because many of them are so dangerous that they kill the people that they infect more quickly than they are able to transmit. SARS, 2003, we had a 10% mortality rate. And I was involved very heavily in warning the world about future potential pandemics in 2003 that could come and sweep across our world. I warned of the same thing in a book I wrote called FutureWise in 1998, again in 2015 in another book. So I've consistently warned our world about the future of global pandemics, recognizing that every year we see more of these things, and every now and then we will have a very, very nasty surprise. Just statistically, it was inevitable that coronavirus, COVID-19, would happen. 2003, the same year as SARS, we saw bird flu with 60% mortality rate. It burnt out. Swine flu in 2009 produced only 0.02% mortality rate, but half of the world's children were infected in less than 1 year, and 25% of all the world's adults. In 2012, we had another very lethal virus, MERS, 34%. Again, it died out. 2019, we have another virus with us, COVID-19 illness, with 1, maybe 0.5%, maybe 2% mortality rate. It's difficult to tell. The important thing is that these viruses are all mutating. And that's how they jump from one species to another. And within species, they adapt. And there's some evidence to suggest from China that we may be seeing around 30 slightly different variations of coronavirus with 2 or 3 major differences in the strains, and potentially very big differences between one type of virus and another within that same coronavirus group in the amount of virus being produced inside the human body. And there are other issues too. We've studied coronaviruses for years. They're only one type of mutant virus that we see emerging. But coronaviruses aren't too good at producing permanent immunity. And we see quite commonly that people have the same coronavirus infection again after 2 or 3 years, and then again. So we don't know how long immunity will last against this particular type of coronavirus. And that's a problem for vaccine production. Now, for some time, I have been helping to guide people about what's likely to happen in terms of government policy. And I've predicted that we will begin to see military type language because this is indeed a global war and nations need to unite to fight it. And as you start to hear this language, it helps you to understand what government policy will be. If you think through the lens of war, imagine that you are looking at a Third World War or Fourth World War. Look through the lens of those glasses. How would governments react? What would you do if you saw all kinds of missiles coming into your city from a strange new enemy and loads of casualties in that first wave? The answer is, if you had them, you would put everyone into underground bunkers to protect them. You would try to learn about the missiles, intercept them, look for the immediate casualties, and then you start after a few weeks to think, well, you can't stay in bunkers forever. We have to defeat the virus. We have to defeat these missiles. And that doesn't just mean war against the missiles or against your enemy. It means preserving your nations. You can fight. It means protecting your food supply. It means protecting your manufacturing. It means making sure your medicines are made. It means that making sure that petrol gets to cars so they can drive, and so on, so that society can continue. So the language you will hear is this: we will fight our enemy on every front. We will mobilize our whole nation. We will protect the most vulnerable. We will take good care of casualties, but we also will maintain morale and community, be confident in victory, and get our nation back to work as soon as we can. So you will see a great dilemma. In a time of war, people would be conscripted, force them to go back into factories, even if the bombs coming down sometimes. Why? Because you can't just stop. And that's the great dilemma as we fight COVID-19 illness, is how far you go in locking things down, especially if you're in a nation which has very few healthcare resources. And I can tell you that the future of coronavirus will be driven not by the policies of President Trump or within the European Union, but it will be driven by the realities for 85% of the world who don't live in America or the European Union or developed nations. They live in emerging markets like Uganda, Tanzania, Nigeria, Indonesia, Singapore, Malaysia. China is a hybrid nation between developed and developing, but other places like Brazil, Peru, wherever you are, many of you are living in some of the poorest parts of the world. And you know yourself that resources are often difficult to find, especially in times of healthcare emergency. So even for a city like this one in China, you will see challenges with particularly the poorest parts of the community who live in the most densely packed areas, who are very difficult to protect through some directive from the government to stop going out of the house. If you live in the poorest slums of Kinshasa or in Nairobi or in Lagos, then you will struggle to obey a kind of lockdown rule. And anyway, why are you locking people down? In the UK, the reason is to stop intensive care units from being overwhelmed. But for the villages in this picture here, it may be a 100-kilometer walk through the bush to reach an intensive care unit. And they may not have any ventilators, and there may not be any oxygen left when you get there. So we have to face the realities that the policies that governments are using in places like the United States are entirely inappropriate for a country perhaps like Zimbabwe that may not have the resources to deal with this. So what will happen? Well, what will happen in a place like Zimbabwe is that the virus is likely to spread, as it was doing, as I explained before, with a doubling time of around 4 to 5 days, maybe a week, which means that it's likely to pass through a country like Zimbabwe very quickly. Let's take Nigeria. Nigeria has a huge population, but it's young, much younger than Italy or Germany or China. And we know that young people are relatively unaffected. We know that there are not very many older people who have, thick medical records with diabetes and multiple, they have heart disease, they've had 2 strokes, they have renal failure, and they are still surviving. Most people like that in Nigeria are not alive. They have gone to meet their maker a long time ago. So you can see that coronavirus spread rapidly through a nation like Nigeria with less obvious impact than in a nation like Italy. Of course, the impact will be there. But the interesting thing is that Nigeria would then emerge into a post-COVID world much more rapidly. It could be within 3 to 6 months. A country like Nigeria might find that most of its population has already been exposed. 70% may have antibodies, and yes, they may see continuing clusters of infection, but the crisis as it is perceived in other developed nations may be gone. Meanwhile, Germany may be intermittently in complete lockdown. So you can see that we have very different futures for this virus depending on where you are, and indeed inside nations too. So China, think of China as many nations inside one nation. Think even of a country like England, or Scotland, or Ireland, or Wales, as different nations within nations, tiny communities with different futures, different diseases, trajectories. Now, 25% have no reaction to the virus at all. They don't seem to produce any symptoms, and they are impossible, therefore, to track. And you can't easily measure the movement of a virus through a community where a quarter of the people transmitting it don't have any signs, and a quarter of those who receive the virus don't have any signs, and a quarter of the people they pass on to don't have any signs. So very difficult to track. And we see another 50% who have mild illness, and then 25% who will struggle. And some of those will land up in hospital. And of those who go into intensive care, half of them, even in a country like the UK, will die. So back to the virus again, how do we manage this and what's going to happen? Well, you've seen all of these lists of things being followed in different ways or hoped for. Testing suspect cases and contact tracing, it's a complete disaster area if you have more than a very small number of new cases a day, because it's so resource intensive. So that means you have to bring the numbers down through social distancing, lockdown, all of that, to try to reduce the pressure on your health service. That is assuming there is a health service there that has capacity. If there isn't, then there's not much point in going through the massive social distancing and lockdown, or at least there's much less. At the same time, of course, nations have been doing what they can to ramp up healthcare, to increase capacity, and to develop better supportive treatments. And with every day that goes by, we are learning more about our enemy, how to defeat coronavirus. And we hope that we will be able soon to start testing people who have had the virus, to be sure that they have had it, so they can go back into the community without fear, hopefully, of getting it at least within the next year or two again. But the real issue is vaccine. How long would it take to develop one? And here we have to be truthful. With Ebola, it took 5 years to develop a vaccine. With HIV, we have been trying for 32 years, and we are still 15 years away, I think. So how long will it take? I don't know. It may be that we develop a whole range of things, each of which stimulates the immune system a bit, rather than find one traditional vaccine that works. In the meantime, we can't lock down the world forever. So that is why you are seeing the easing of lockdown, even in nations which are seeing spread continue. And you're seeing nations into three groups here. People like New Zealand, which have more or less wiped out their own local spread of the virus with strong data, and they can go about relatively normal life quite quickly. Then there's mid-range nations where there's good data, but even there are risks. So Singapore thought they had control, and then the virus suddenly spread rapidly into migrant workers who are very packed into residential units. Then you've got nations with high numbers, and where there is poor data. I give one example is the United States, and I'm sure very soon we'll see examples of this in Africa. It's just that we don't have the statistics. And again, we'll see for different reasons, easing of lockdown. In the US, because there is no political will to wipe out the economy, and there's also national confusion about policy, and in many African nations, because it doesn't make sense to make your population starve if they are subsistence farmers, and they need to have basic access to the market to be able to survive. So here's the big issue. We can't afford to have the whole world into lockdown every few years just because another mutant virus comes along and then wait another year or two for a vaccine. What we need to do is 80 years of medical research in about 80 days. We need to find a cure. You see, in the 1940s, 8 years ago, Alexander Fleming discovered penicillin, but we have never yet found a single drug which is as effective as penicillin was then against a single virus today. So we need drugs like penicillin to block the cell surface receptors, to block the translation of the RNA into the DNA of the cell, to block manufacture of the virus, and to block release. And possibly other things as well. For example, blocking the cytokine storm we see, which is typically around a week after infection has taken place, when the person is feeling a little bit better, and suddenly the immune system goes into massive overdrive. We need to find ways to control this too. Now, when we find better antivirals, we will find a solution not just to COVID-19 illness, but to the next generation of viral illnesses and to existing ones like flu and common cold and things like that. So that's what I'm praying for, that we have in future a pharmacy cupboard full of effective, low-cost medicines that we can use against a wide range of viruses. Now, people often ask me from a Christian background whether this is some sign of the displeasure of God, or whether this is God's anger or wrath or judgment, or if it's the sign of the end times or what. I just like to point something out. Out of my window here, I can see a harbour on the south coast of the UK, and I can see some ships going in and out. And I can tell you that in this harbour, in around 1340, bubonic plague arrived on one ship, one boat. And that bubonic plague, we now think, wiped out around half of the entire UK population. Was it a sign the Lord Jesus was coming back? No. Was it part of the normal life of humanity, which involves disease and suffering? Yes. Do we understand all of the mysteries of this? We do not. So I would say that plague has a big history for us. And it's interesting, if you look at prayers that were written, that are used today in Anglican churches across the world, that were written, in fact, in the UK in around 1500, 1600, you will hear the word plague repeated. Protect us from plague. Why? Because plague was common in those days. I've been reflecting on the life of St. Paul, and here was one amazing person. St. Paul is the most influential Christian who has ever lived. St. Paul is more influential than any other Christian alive today, over 2,000 years after he died, for only one reason: isolation. St. Paul was forced into isolation against his will. He was put in prison with only a very small number of people to interact with. And he was in despair. We know this from his own writings. He cried out to God, "Why have you put me in prison? Why can't I exercise my ministry to plant churches, pray over leadership, disciple, to teach, evangelize?" And as he cried out to God day after day after day, eventually he suddenly realized a truth, which is that although his voice was locked up, although his hands could not put hands on new leaders to pray over them and commission them, although his legs could not take him anywhere, he actually could write. And with the help of another, perhaps to write his words for him, messages on pieces of parchment could be taken out of that prison. I cannot imagine that he thought that his words would survive so long. I cannot imagine he even thought that every one of his pieces of parchment would reach a church. But they did. And St. Paul became the world's first virtual apostle, the first digital discipler, because his words became multiplied 100 billion times by every means you can imagine, as monks transcribed them over generations with pen onto more pieces of parchment, and then as the printing presses began, and then through the digital age, and through every medium you can imagine, St. Paul's words continue to encourage, sustain, inspire, and equip future generations of believers. Isn't that amazing? And I think about the Church of Jesus Christ in lockdown in many parts of the world. I think about hundreds of thousands, millions of church leaders who are responsible for 2.4 billion believers around the world and their spiritual welfare. I think about this army of apostles, teachers, ministers, whatever you want, of people who are called by God to be his agents in the world. I think about all their communities of congregations, of doctors, of nurses, of teachers, of whoever they are in the world, whatever they're doing. But in lockdown, many of them, not necessarily the doctors and nurses, of course, unless they're sick, but in God's providence, I am seeing, and you are seeing, a mighty explosion of faithful, spirit-filled communications ricocheting around the world. People often say that Britain is a post-Christian society, that it is full of atheists and the rest. Well, I'll tell you something that's true. Surveys show that around 3% of the population is evangelical in believers, but around half would say they have some kind of faith. And it's amazing when people are in pressure, they pray. And you know what? A survey showed just 2 weeks ago that a quarter, yes, 1 in 4 of the whole population of my country has recently watched a service, a church service, on their own digital screens. Amazing. You think that church attendance would normally be only 4%, maybe 5% of the population at most, but 25%, that's 5 times that number, have recently watched a church service digitally. Why? Because it's part of this digital explosion, my friends. So I'm just saying that to encourage you. And in the workplace, you are the fragrance of Christ. You're not in lockdown if you're care workers. You are right on the front line. And I thank God for your life and your witness. And whatever you may feel like inside, Paul tells you, St. Paul writes that you are the aroma of Christ. You may not feel it. You may not even know it in your heart, but it's a fact. Something within you changes the situations that you're in. I specialized to start with in my career as a hospice doctor looking after people who are dying. And I have seen many, many people at that juncture between life and eternal life, between this world and what is to come. And it's a very deep and profound spiritual experience. Indeed, I have witnessed it in my own family, sitting with my own dear mother, holding her hand at that moment in last week, less than 4 days ago. I was there at her passing on as someone who was at peace. She knew where she was going. She had a strong faith, which it was a privilege to journey with her through and to be praying with her as she went to be with the Lord. But I will not forget a patient who, I can't remember her name, but I was on the general ward, and I think the first time I had met her, and I was told that she was very sick with cancer and was not expected to live for more than maybe a few weeks. And as I sat next to her, she reached for my hand and she looked into my eye and she said, "But doctor," she said, "you know where you're going, don't you?" I was a bit taken aback. There I was on a general ward. We had not exchanged a single word. And she had reached for my hand. She had looked into my eyes and she had seen a hope of eternal life. How, I do not know, except that it's something of the aroma of Christ that is in you and in me. And I looked at her and there were tears in her eyes. And she said, "I too," as I nodded, she said, "I too have a hope. I know I have an eternal future. But these doctors, they won't talk to me about what is happening to me. No one will tell me the truth. But I know that my day is coming. And there were tears in my eyes too. I didn't really need to say very much, but just being with her in that moment of her own journey was bringing her hope and the comfort of eternity. So I just want to encourage you in your journey, whatever you feel like in the middle of this COVID nightmare, which it is, however pressured you feel, however inadequate you feel on the ward or at home, in the home of a patient or at the bedside of someone who's dying, or comforting another medical colleague who is at the end of their own resources, just know that you are the aroma of Christ. And Peter writes to the church in 1 Peter 3:15 that it is in us to share the hope that we have, the hope that we have. And sometimes it's words, but actually it's also a life that we live, a life observed by your colleagues and your patients. And there's a time for both, a time for the words and the time to just be. I'm sad to say that with COVID-19, an image like this is difficult, but the truth is still here. And Paul also writes in 2 Corinthians 1 verse 4, he says that we have troubles. Yes, we do. But in those troubles, we find comfort and solace from the Lord Jesus Christ. And if we suffer, it is our lot. That is part of our life story, but it is for the salvation and for the encouragement and blessing of others, because we then share the comfort we ourselves have received from Christ. It's as we live through periods of pain ourselves that we find our inner resources in Christ that becomes our own story of hope to sustain another in a trouble of their own. And of course, in the middle of that too, there's great rejoicing, as well as sometimes sadness and feelings of not being able to cope. These are really important times, and we need to recognize the impact on mental health, not just in the general population with fear and sometimes because of the problems of lockdown, but also just amongst our own medical colleagues. I recently did a Zoom call to around 1,000 people in New Zealand where there's been hardly any infection. I asked for a show of hands, and I could see around 450 different faces on my screen. At many sites, there were more than one person. I asked them to wave at me if in the last 3 or 4 weeks, they had felt more likely to burst into tears or to find tears pouring down their face than they would normally. And around 70% said yes. I asked a corporate event, I asked leaders of companies around the world the same question and the same answer. Around 70% are saying that they feel more emotional, their feelings are exaggerated, their view of the world is colored. This is a challenge because those who already are on the edge of mental health problems are finding themselves right on the edge of a cliff. So we have, I believe, a tremendous opportunity with the hope that is within us to share something of peace in the middle of crisis, keeping our eyes fixed, not on what is seen, which is often chaos and an artificial view of suffering seen on the media, particularly on TV. What we see there is only a tiny fragment of the truth, but keeping our eyes fixed, not on what is seen, but on what is unseen. Why? Because what is seen will pass, and COVID-19 will surely pass and will be history, thank God, but on what is eternal. So those are just the thoughts I wanted to share with you, and the time really is yours, and I'm going to have a look and see what we've got here on questions, and see where we go. Peter, back to you.
Thank you very much, Patrick. Incredibly comprehensive, big picture. but then just focusing right down at the end on what our responsibilities are as Christian health professionals. And thank you so much for your testimony as well as your wisdom and knowledge. So we've got the questions starting to roll in now. So if we could start, Patrick. The first question I've got for you, it's for those of us who called to do ministry in the business world, but still studying. What would you say to a younger Patrick Dixon, if one actually exists at all? How do we grow in professionalism, eloquence, kindness, character? From your many years of experience.
I can't answer that. I have no idea. I think all I'd say is wherever we are, I think one thing that I've learned in life is that we can't do everything all at once, but there are many lives you can have in a life. And I think sometimes, especially when we're young, and I've sensed that you are probably sort of in your 20s or 30s and full of dreams and aspirations, and you're called to change the world. And we may debate about which part of the world and how wide that change will be, but you're called to be a world changer. And the most important thing is to seize the day where you are. I think that's all I'd say. Forget about tomorrow and how you're going to change the world when you're 55. The Lord takes care of that, and you may not have that time. Someone once said to me, "Why did you write 3 books in 1 year?" I said, "I didn't know I'm going to be around next year. Do you?" So seize the day. My favorite phrase, carpe diem, seize the day. Our Lord says, don't worry about tomorrow. Tomorrow will take care of itself. Yes, we must be responsible. We do our studying, we prepare and the rest. But at the end of the day, today is the day. Today is the day. Today is the day. It's a COVID-19 day. Let's seize this day. I've talked about virtual communications. Let's not wait for the churches to reopen. Seize the day. Let's not wait for some great promotion to come so you can make $1 million and give it away. Seize the day. Give away what you have. Let's not wait till you become a doctor. If you're in training, seize the day. Go and bless a patient. Just be with them. The greatest thing we can give to people is to be present, I believe, in this time. Seize the day. It's not about necessarily doing. It's about being with people, even if it's just virtually. Seize the day. So that's what I'd say. And then the rest, hopefully, will take care of itself. That's my answer to that one. Should I file on the next one, Peter?
I think that's a great answer. So, question from Australia now. Their data shows that the case fatality rate is 0% for those under 40, 0.1% under 50, 0.2% under 60. So with such low numbers, and given on the basis of what you've said that a vaccination is very unlikely in the near future, or perhaps at all, is the shutdown of the world really justified, in your opinion? Or do its effects outweigh any benefit?
All right. Well, listen, let me just say, I live in a country which is around 1% infection rate at the moment. You think, who cares, 1%? Listen, I've given you the facts already. 1% becomes what? 2% in how long? 4.5 days. Okay, so what's today? Today's Thursday, isn't it, Peter? So Tuesday, we'll have 2%. Oh, by the following Sunday, morning, we'll have 4%. By the middle of the following week, we have 8%. Oh, on the middle after that, 16%. Okay, you still wanted to talk to me? Oh, after that, it's 32%, 4 days after that. Are you still talking to me? You hear what I'm saying? Please do not underestimate this epidemic. If you have virtually nothing in your country, thank God for that. I have told you, 1 case becomes 1,000 cases in 10 doublings. That's, in most countries, only 40 days. That's a month and a half, my friends. A month and a half to go from 1,000 to 1 million. If you live in Australia and you think that somehow the distance between your cities in your wonderfully huge country will save you, think again. If you think that living in a rural area of New Zealand will save you, think again. Be careful. Do not underestimate this virus. It is a terrible killer. Those people who are coming out of A&E, the survivors, will probably have, we think, 10 years knocked off their life expectancy, even if they survive, because of damage to their lungs, fibrosis, damage to their heart, damage to their livers. Please do not underestimate this virus. If you live in a country and you have the capacity to deal with this, deal with it. If you don't, then we need to be praying. But I would say if you have capacity and don't use it, I think that is irresponsible. Now, of course, if you happen to live, let's say, suppose in a city in Australia, and you've more or less shut down the flights coming in and out of that city, and you've stopped the trains, and you've stopped the road traffic, and you have virtually no infection. Yeah, sure, why not? All back to work, contact trace, test people like crazy, and hopefully you can live a normal life, but you need to be very careful. Okay, next one.
Immunity passports. Very controversial. What do you think?
Yeah. Okay, so let's be clear what we're talking about. We're talking about going into a town like this one. This is 50,000 people where I live. And we set up a testing station by the roadside and we say, you think you've been sick? Come and get tested. Prove it to us. And if you have been tested, then they give you a nice green card. They say, here you are, here's your photo ID, green card, post-COVID immune, you hope. So they say, right, go to the cinema, go to the pub, spend all your money, go into the restaurants, go and stay in hotels, go and have fun, go and spend all the money you saved and stimulate the economy. By the way, go to work tomorrow, okay? We need you back in society. Good idea. Next thing that happens is you have a whole load of people, I'm making this up, but it's not actually a joke. Okay, a whole load of people think, okay, I'm only 20-25, so my statistical chances of dying from COVID, low. Statistical chances of getting bankrupt from not running my business, high. What shall I do? I shall go and visit as many COVID patients as I can find and get them to spit on my face or do whatever they need to do to get me infected. And I'll make sure if I do get sick, I'll go straight to the hospital. And I'll do it when the numbers are nice and low and there's enough intensive care beds to help me. So I can get a passport as fast as I can, because then I can do whatever I want. So that's another risk, isn't it? But we will have COVID passports. We have to have them. We will find ways of categorizing people into very vulnerable, over 75, many medical problems, ring of steel around them, young, relatively immune, could be out there taking all kinds of risks. It's not going to be a disaster. Remember, we're talking about wartime response. We're not talking about trying to stop every infection. I'll tell you this, quite soon in my country, there's going to be so much spare capacity in hospitals, if we're not careful, this sounds terrible to say it, that the government could even be encouraging people to go out and get infected. Think, what? That's already happening. They're saying, right, you can start to meet a few people, not too many, but one or two. You can start some people traveling on the underground, on the metro and the buses. Why? Because we have to keep the system running. We've created this huge capacity. You can't just what if we don't have a vaccine? What if there's no vaccine in 5 to 10 years' time? The best thing is to help people to get COVID in relatively small numbers at a time, in a relatively safe way, with all the backup we can, and get through this. So it's controversial, but it's going to be important, Peter. Well, the next one's long.
Next one's long, but it's about mental health problems. So okay. Given that social distancing and lockdown produces more mental health problems, what's the balance there, and what would be your solution to reduce the number of mental health problems that people suffer from lockdown?
I think it's a really big issue. Yeah, it's a really big issue, and it's not just mental health; it's physical abuse. Think of, say, a woman in an abusive relationship who's been threatened by a husband who's beating her up regularly, who gets drunk, who in lockdown feels he can get away with anything. You think about a child that's very, very vulnerable, being sexually, physically abused over and over again. I talk. One of my own children is a social worker. She is stressed by the thought that her normal contact with clients is falling apart. These are really, really, really big issues, and they are the invisible toll, if you like, the invisible burden of coronavirus. So it is quite right that we focus on these things. What are my solutions to reduce the number of psychiatric problems and mental health issues? I think it's twofold. One is to have some common sense about lockdown. So let me give you an example, okay? So I'm going to confess something to you. I told you something really sad, which is my mother died. And she died on Sunday. And I'm going to tell you that at the time when my mother died, the lockdown rules were pretty strict. But for various reasons, as my mother was dying, there were really, really big decisions that needed to be made with my two brothers. And on two occasions, staying at my mother's house, which even to move to my mother's house, which is 3.5 miles away from our own home, but it was the only way we'd be able to be at her side, just 10 minutes away from the hospice where she was. So my brother came round and sat in the garden at 2 meters distance, 3 meters distance, on two occasions for 1.5 hours each. So we broke the rules. Now, I've been in lockdown strictly for 8 weeks. I hadn't even been in a car for 4 weeks. But common sense and in terms of mental health and well-being needed to be taken into account, and finding some way to manage ourselves through a catastrophe. So we need to be careful, sensitive, use common sense to be protective of us, of others' health, protective of our own, while not losing, what it means to be human. And there are lots of things we could do if we think about it. It sounds crazy, but I think about a guy who's been sitting outside the window of his dad, and the dad is in a care home and has dementia and can't see him. So he's been sitting outside the window and they've been having a conversation on the phone. Okay, it's not that's quite the same, but things we can do. Let's be creative. Let's be resourceful. Let's be prayerful. Let's be compassionate. Writing of notes, I think, is an underrated thing in this digital world. We bought 100 cards, I think, on the first day of lockdown. 100 cards from someone else in the church who makes them. And we've been sending out cards systematically to anyone and everyone we can think of. Sorry, if you haven't had a card from me, it's not that we don't like you, okay? It's just there are quite a few people we're trying to write cards to. But just writing cards. Why? Because cards stay on mantelpieces. They stay stuffed in Bibles. They fall out of Bibles 20 years later. So, oh, that brings tears to your eyes again. I say, I'll never forget, I was in trouble. And I got that little card saying, I'm thinking of you, praying for you, and here's a verse to sustain you. Little things make a huge difference. I think that's my message in general, actually. It's the smallest things that often have the greatest impact on other people's lives, and we don't even realize it, especially when it comes to mental health. It's just a thought, it's a text. A single text can be enough to bring another person to tears and to bring them great comfort. It could be just a single text, and all it says is, just to let you know that there were 4 of us this morning in our home, and we were praying for you for 15 minutes, and we've been doing that every day for the last month. Wow. So little things, let's make the world turn with 100 billion acts of human kindness, because that is what will take us through COVID-19.
Now, you talked about the spiritual hunger and that amazing stat, 3% of Brits go to church, but 25% have attended an online service at some point. So how should the church be being creative in making use of the spiritual hunger, which might not last beyond COVID-19 when they're not asking the same questions?
I don't really know the answer to that, except carpe diem, seize the day. I mean, I can think of a neighbour who lives just a couple of doors down, and I don't know how many people on this call have seen or watched a video of a song called "The Blessing." It's a particular song. If you haven't heard it, type in "Blessing." Just type in "Blessing Zimbabwe," "The Blessing UK," and you will see different renderings of this. And different nations have done this. This is about 20, 30 or 40 singers or 50 singers. They've all sung the same worship song. And someone has edited it together in a very clever way. So you then see 50 people in their homes all singing a song of blessing over their own nation. Amazing, moving. So we sent the UK version of this particular song went from 28,000 views to around 500,000 in about 12 hours. It's now up at 2.5 million views, and they're not all Christian views. So my wife, when my mum was very sick, a week and a half ago, she sent a link to this blessing to a friend of ours who isn't a Christian, we've been praying for, we've prayed for her. She's very close to faith, living in our street. And just said, I thought you might find this song encouraging. And she said, I've played that song over and over again. She works in care homes. She said, I've been playing it to my patients. I've been playing it to everyone I go to, because I think it's just such an amazing, inspiring song. Little things make a lot of difference. And I just believe that You know, I say it's 100 billion acts of human kindness. It's 100 billion acts of tiny little things to say, I thought you might find this song interesting. Hey, here's an interesting. The next thing we did is we sent her the midweek sermon of our vicar. Why? Because actually he was talking about the struggles and strains of being in lockdown, and we just thought there was something in there for her. Let's just, I say, we are the aroma of Christ. Let us be that to those around us, virtually or physically, in any way we can. And let's let the Lord take care of the rest.
Seizing the day again. So you talked about global immunity. Is it an achievable target for COVID-19? Or you know, what should we even be aiming for?
It's the other way around. We have to be practical. It's an irresistible destination. When you have a virus that, with SARS, we nearly got into this mess in 2003. We were very fortunate. There was just only two big clusters. One was in China, the other was in Canada, in Toronto. The Chinese reacted in their normal style, huge, heavy-handed, barbed wire machine guns around hospitals. If you were a doctor or nurse, you went into work that day, you were not allowed out. They said you're only coming out in a body bag or curated. Other than that, you stay in the hospital till the thing's over. That's how the Chinese did it, and they got control quickly. And the Canadians did it through gigantic contact tracing efforts as a national emergency. And we only had 8,600 cases. My word. I said at the time it would only have taken one single case in Kinshasa on a single plane, and we had had a global pandemic. Because a nation like that would not be able to detect, contact trace, or anything else. And that's precisely what's happened now with COVID-19. So let's just face the reality. We have lost control of COVID-19. That happened in mid-January. Not helped in the UK even, we've imported 5,000 people have come into the country on planes infected in the last month, we think statistically. So massive crisscrossing of the world with this virus. We've lost control of it, and humanly speaking, miracles aside, the whole world will get it. Well, not quite the whole world, but 70% of the world will develop antibodies to COVID-19, to the virus causing COVID-19 at some point in the next 1, 2, 3, 4, or 5 years. It's just a repeat of what happened in 1918-19 with Spanish flu, which killed 40 million people back then. So that's the reality of pandemics, and that's what happened with, that's what happens with flu every single year, for goodness sake. We know this as doctors, it's just what happens with viruses. So how we think we can prevent that from ever happening in the world, just because this virus kills more people, is beyond imagining. So we're talking about really, I think, managing a long-term process, unless we get a global vaccine. But then tell me, how much time and money will it take to develop 7 billion doses of a global vaccine? That's number one. And how long do you think the vaccine will last? Do you think you'll have to do it every year, like flu? We just need to be realistic about these things. So what we will see is global immunity will develop. I've said it will develop fastest in the poorest nations. A nation like Nigeria will develop a very robust immune response in the whole community, I think, within the next 6 months. I think Africa will come through this relatively rapidly. Indonesia, the same. Philippines, the same. China could take a long, long time. Germany, a year, 2 years, 3. UK, who knows? Okay, should we go through the next one?
We just do one more before we stop for a break. So it's a long question here, but it's really saying that COVID-19 has exposed both lots of inadequate health systems around the world, but also lots of inadequate leaders as well of individual countries. Is it time for a global focus on health system strengthening so that we're better prepared for something like this coming more or coming again in the future?
Okay, so at a time of world war, usually what happens is nations cluster into 2 groups or 3 groups. We're in a world war, but all nations should be clustered in 1 group. And that has not happened. What we're seeing is splintering, divergence. Even within nations, we're seeing chaos. A time of world war is not the time for bickering, it's a time for unity. It's not a time for scoring party political points in your own country. It's a time for praying for your leaders and standing with them. I promise you this, I would not like to be the leader of a country at the time It's a difficult and stressful job, and there are no right answers. And whatever you do, historians will debate the rightness or wrongness of it for 10 generations. So let's stand together. We need to be united in this, and we need to support every vehicle for that we can, including the World Health Organization.
That's all we've got time for at the moment. So thank you very much, Dr. Patrick Dixon, Life Beyond COVID-19. So our next seminar is on Monday, same time at 2 o'clock BST. And we've got Dr. Bobby John from India, who's going to be talking about some of the community health challenges and how to flatten the curve in low resource situations. So it remains for me to say thanks again, Dr. Patrick Dixon. Thank you for all of you who are coming, and do spread the word and visit our website and watch again.